Hello, my name is Rose Stewart, and I am a consultant clinical psychologist and the diabetes psychology lead for Wales. I work with lots of people with type 1 diabetes and neurodiversity. A really important aspect of managing that double whammy of neurodiversity and diabetes is communicating with your healthcare team. In my experience, the vast majority of diabetes healthcare professionals won't have received any training at all on neurodiversity, so they won't understand what a particular person's needs might be and how best to meet them. And of course, we know that if you've met one person with neurodiversity, you've only met one person with neurodiversity. Everybody is different. Everybody has different needs and different difficulties and different strengths. And so it's really important to be able to communicate those needs and areas of difficulties and strengths to your healthcare team so that they can understand how to support you. It can be really helpful, especially if you don't feel confident about communicating with your team in person, to maybe thinking about emailing the team in advance or writing to the team. And you can fill out things online like health passports and communication passports. There's a really good one on the Autism Info Wales website. You do have to register for it, but it's free. And this creates a profile that you can then send to your diabetes team and have saved in your healthcare notes. And this will detail all of the things that you find difficult and all of the things that you find more helpful that they can do. If you find that you tend to get a bit overwhelmed in clinic, it might be useful to prepare for clinic in advance. So lots of people find that it can be useful to write things down before you go in. And you can think about maybe emailing these over to your healthcare team in advance as well, so that they're also aware of the things that you are finding difficult at the moment and the things that you might want advice on. Obviously, clinic can sometimes be a bit pushed for time, so I generally advise trying to think about your top 3 issues. Sending it over to the team can really help to shape that consultation so that you feel comfortable. Autism is a lifelong condition. So instead of trying to change the way that you interact with your hospital or clinic environment, we need to look at how the hospital or clinic environment can be shaped around you. Under the Equality Act 2010, you can ask for reasonable adjustments to be made to your clinical and hospital environment. And this still applies even if you haven't had a formal diagnosis of autism, because it's based on your needs rather than a diagnosis. If you are on a waiting list for an assessment, and we know that lots of people are at the moment, you can still ask for these changes to be made, and you can use a phrase like working diagnosis to help people to understand where you are in that assessment process. So some of the changes that you might find helpful or you might want to talk to your team about could be things like having your appointments at a particular time of day, maybe thinking about a time where the waiting room might be less busy, or even waiting in a separate area so that things might feel a bit less overwhelming. You can also ask for things like changes to the lighting or noise level in clinic room, and you can ask about the number of people in your clinic room as well. The diabetes healthcare team is here to support you. We want you to feel comfortable and happy and not stressed and overwhelmed when you come to see us in clinic. Something else that it might also be really helpful for you to do is to bring somebody with you to your appointments. It can be really helpful to have somebody there in an emotionally supportive capacity for you, but also if you tend to find that you start to get stressed or maybe go into shutdown during clinic appointments, that person can be there to either recognize that in you and to communicate to the team that you might be finding things difficult, or they might be able to help to communicate on your behalf if you find that it's difficult for you to get the words out sometimes in clinic. And if somebody comes into your healthcare appointment with you, they can be really, really useful afterwards in maybe reminding you what happened during your appointment. What you can also do is ask your diabetes team to send you a summary of the appointment after it's happened. This might be in the form of an email or it could be a clinic letter. And that helps you to have a reminder of what was discussed and what was agreed with the next steps.